Now, the Pharmaceutical Society of South Africa has raised concerns about the decision to grant the South African Post Office permission to dispense chronic medication. The decision would allow patients to skip queues at pharmacies and collect their medication at 300 post offices around the country, with the exception of the Western Cape. The Pharmaceutical Society has denied it was consulted by the South African Health Products Authority on its decision. The society expressed concern about the post office's ability to comply with the rules governing handling and safekeeping of medication. Meanwhile, the post office is adamant it's fully equipped to do so. Joining us now to share their concerns is President of the Pharmaceutical Society of South Africa, Joggie Hattingh. Good to have you with us this evening, and thank you very much for your time. So, from my understanding, patients can now collect their chronic medication, or at least is what is being reported, from more than 300 post offices across the country. The post office says that it has trained staff to handle medication, and they are using high security storage to store this medication. The Pharmaceutical Society of South Africa saying, we're concerned. The South African Health Products Authority, responsible for upholding Medicines and Related Substances Act, saying it's not our issue to police compliance. It's the South African Pharmacy Council that needs to do so. The South African Pharmacy Council says we were not consulted. Is that where we are sitting with this particular matter right now? And how does it get to this?
Thabo, maybe let me start by saying that the Pharmaceutical Society is not against the CCMDD process where the chronic medicines is taken to the patient, or as close to the patient as possible. We are in full agreement with government that that is the best option available. Our concerns are more about whether the post office is the correct facility to utilize. And I have seen the press release by the NDOH regarding other pharmacies being utilized, which I think would be the better option. So you ask how it has come to this point. I think the agreement started in 2015, 2016 around, but it never came off the ground. Or to a very limited extent, that the post office did handle medicines. The questions that we have as pharmacy professionals is, firstly, we are held to very high and strict standards when it comes to medicine, because it is in the best interest of the patient. Our concern is that the post office may not be able to maintain that value chain that we are responsible for as pharmacists. So our concern is, firstly, the safety of the patient.
Right. Now, how well is our chronic medicines distribution system working currently? I mean, because, of course, we know that someone taking chronic medication is definitely not ideal for them to be picking up medicines in crowded places, long queues, and so on and so forth. So do we have a program in place right now, and why the need to augment that program with the post office services?
There are numerous programs in place to get the medicine to the patient. Part of it is utilizing private pharmacies. That includes the corporate pharmacies, but it also includes quite a number of independent pharmacies. The post office is a difficult entity to get my thoughts around. I have questions around the efficiencies in the management of the parcels from them. And I would have huge concerns if we see another post office strike, because that would mean that a large volume of parcels are tied up, They're already dispensed and prepared for the patients, but it's not accessible to the patients. Another concern would be the parcels that patients do not pick up that must be returned. For me to receive a parcel back from anywhere, I need to have certainty that the cold chain and storing conditions were adhered to throughout the system. And I have not seen any evidence that post office is able to do it. I hear that they say they have trained staff. The only trained staff that may handle medicines would be staff registered with the SA Pharmacy Council. And so to train other groupings of staff, yes, they do not dispense medicine. That we have to be clear about. The medicine is dispensed at a central dispensing facility, which is a pharmacy registered with council. The comment that they make is that they are just delivering that medicine.
So it's going to be pre-packaged.
In delivering the medicine, you have to, that package needs to be treated differently to any other commodity. So I do not know what training the staff has been given that would qualify them to do so.
So from the Pharmaceutical Society then, what do you think would be the impact of this particular decision? I mean, you've already mentioned, for example, the impact on the rules that govern what you do, the storage issues. But what is your concern would be the broader impact of this, maybe even quite detrimental to the lives of patients who take this chronic medication?
So in any pharmacy setting, we have very strict control over the temperature range in which medicines are kept, as well as humidity control. If that is exceeded, then your medicines are compromised. So most patients on chronic medication will receive parcels for 2 months at a time. So if medicine is compromised, you give a patient 2 months medicine most of the time, which is possibly compromised. So we do not know how the efficacy of that medicine is affected. Now the patient returns home with 2 months medicine thinking that his chronic disease is well controlled. And I think it is not in the patient's best interest to utilize the post office for such a function. I think we are more than willing to consult and to try and assist to get a system going. I think if you look at the footprint of pharmacies throughout the country, it's an enormous footprint. There are always some of the small, very rural towns where you will not have a pharmacy, but there we have other healthcare workers who could assist.
Hey, Joggie, what do you make of the department's response saying, no, don't panic, we've been doing this for 8 years, we've been running a program called the CCMD, the Central Chronic Medicine Dispensing and Distribution Program, since 2014, basically saying through that program we have managed to enroll 5 million patients on this program. So we've been doing this. This would simply be an extension of that program?
They have, to some extent, used to a very limited scale some post offices. But most of the CCMDD program parcels were handled by in-house health facilities. But it is true that to simply have the medicines dispensed at another facility and then have the people queue in our own facilities again to pick up the parcels is not that effective. I think one will have, as I say, we will be more than willing to assist to see how we can improve that footprint to take the medicine closer to the patients. And many of our corporate pharmacies and many of our independent pharmacies are willing to assist in that. Okay. With the CCMDD program, the patient will still have access to a toll-free number that they can phone if they have any concerns. But for me, the first prize would be if there is a pharmacy staff member at the facility where they get their medicines, where they can raise their concerns and get answers, which will not happen at a post office. So another concern is parcels that needs to be returned. If it is in a pharmacy, if those medicines are temperature controlled and recorded to be so, that medicines can be returned and utilized. Once it's out of the temperature control environment and once it's been in the patient's hand, then it cannot be returned. Then that medicine will be wasted.
Joggie, I appreciate your time. Thanks so much for coming on. Joggie Hattingh, he is the president of the Pharmaceutical Society of South Africa, raising concerns, but also saying the pharmaceutical sector, independent pharmacies are willing to come on board and to assist.